صباح الخير طلاب. Today we're talking about the first lecture in beta-lactam and other cell wall inhibitor antibiotic. Beta-lactam and other cell wall synthesis inhibitor antibiotic. Actually, some antibacterial drugs selectively interfere with the synthesis of the bacterial cell wall, which is a structure that mammalian cells do not possess. So, for example, humans, our cells, there is no cell wall. We can see cell walls. So when you take antibiotic or this part of antibiotic, it's not harm our cells. This antibiotic just harm the bacterial cell wall because they interfere with the synthesis of the bacterial cell wall. The cell wall is composed of a polymer called peptidoglycan that consists of a glycan unit joined to each other by peptide cross-link. يعني هذا الجدار الخلية البكتيرية هو عبارة عن متكون من بوليمرات اسمها الببتيدوغلايكان مرتبطة مع بعضها البعض بوحدات من الجلايكان وأكو لينك بيناتهم. To be maximally effective, an inhibitor of cell wall synthesis require actively proliferating microorganism. حتى يكون يعني effective أو أكثر فاعلية هو راح يشتغل على هذا cell wall synthesis which require active proliferating microorganisms. The most important members of this group of a drug are beta-lactam antibiotic, named after the beta-lactam ring that is essential to their activity, like penicillins, cephalosporin, monobactams, carbapenems, and beta-lactams inhibitors and cell wall destruction. And now this picture or diagram indicate the classification of the agent which affecting the cell wall, which is beta-lactam antibiotic and other, regarding to your source box living code. Beta-lactam antibiotics such as penicillin, cephalosporin, carbapenems, and monobactams. Others antibiotics such as bacitracin, vancomycin, diptomycin. Penicillin, there's different kind of penicillins. And for cephalosporin, we're talking about cephalosporin in the next lecture, inshallah, and about its fourth generation. So this is classifications of agents that affect the cell wall, which is beta-lactam antibiotic and others. We're talking in these lectures about penicillins as prototypes of this group. So we're talking in these lectures about penicillin, mechanism of action of penicillin, antibacterial spectrum, resistance, and pharmacokinetic, therapeutic use, and adverse effect of penicillin. So, for overview of penicillin, antibiotics or antibacterials which are types of microbial used in the treatment and prevention of bacterial infection. They may either kill or inhibit the growth of bacteria. The penicillin is naturally produced by fungi of the genus Penicillium, and this is the picture indicated the fungi genus Penicillium. Penicillin is a common antibiotic used to treat bacterial infections. It was discovered by Scottish scientists in 1928. As you remember in the last lecture, we تكلمنا عن البكتيريوسايدال, bacteriostatic, وقلنا إن البactericidal and antimicrobial drug that can eradicate an infection in the absence of host defense mechanism, which is that means kill bacteria, while bacteriostatic and antimicrobial drug that inhibit microbial growth but require host defense mechanism to eradicate the infection, which does not kill bacteria. Beta-lactam antibiotics, the drugs with structure containing the beta-lactam ring, include the penicillin, cephalosporin, and carbamazepine. This ring must be intact for antimicrobial action. So, regarding to mechanism of action of penicillin, actually it is divided to 3 types of mechanism of action, and we'll talking about of them briefly, in details. So the mechanism of action for penicillins, the penicillin interfere with the last step of bacterial cell wall synthesis. Okay, it is transpeptidation or cross-linkage. يعني آخر مرحلة من عملية صناعة جدار الخلية البكتيرية اللي هي transpeptidation or cross-linkage. البنسلين هنا راح يبدي شغله بهذه المرحلة resulting in exposure of the osmotically less stable membrane. Cellysis can then occur either through osmotic pressure or through the activation of autolysins. These drugs are thus bactericidal. يعني هنا احنا نقدر نعتبر ان البنسلين bactericidal. Why? Because it is cause kill of the cell, it's cause lysis, it is interfere with the bacterial cell wall synthesis. So what happened when penicillin interfere with the bacterial cell wall synthesis resulted in exposure of the osmotically less stable membrane, which cause lysis. Then that's mean osmotic pressure or through the activation of autolysin, cell lysis can happen. So this drug bactericidal. Penicillin are only effective against rapidly growing organisms that synthesize a peptidoglycan cell wall. Why? Because this organism, rapidly growing organism, they all usually synthesize peptidoglycan cell wall. واحنا قلنا ان عمل البنسلين راح يكون على هذا السل wall. Consequently, they are inactive against an organism devoid of this structure, such as mycobacteria, protozoa, fungi, and virus, because these organisms, they don't, or they devoid of the structure of it, which is cell wall or a peptidoglycan cell wall, because penicillin effective only against rapidly growing organisms that synthesize peptido cell wall. Now, regarding to the mechanism of actions, firstly, penicillin binding protein. Penicillin inactivate numerous protein on the bacterial cell wall. Now, firstly, I'd like to say how penicillin interfere with the cell wall synthesis. Firstly, penicillin binding protein. Penicillin inactivating numerous protein on the bacterial cell wall. These penicillin binding protein PPS are bacterial enzymes involved in the synthesis of the cell wall and in the maintenance of the morphologic feature of the bacteria. Exposure to these antibiotics can therefore not only prevent cell wall synthesis but also lead to morphologic change or lysis of susceptible bacteria. So the first mechanism, which is inactivate numerous protein of the bacterial cell wall. or this penicillin binding protein, it is an enzyme or bacterial enzyme. This enzyme involved in the synthesis of the cell wall. Okay, what is the penicillin do this enzyme? Inactivate this enzyme. So what happened? It will lead to prevent cell wall synthesis and also lead to change or lysis of the susceptible bacteria. Second mechanism, which is inhibit of transpeptidase. Some penicillin binding protein catalyze formation of the cross-linkage between peptidoglycan chain. As we said, it is a change in the cell wall, and there is a linkage between them. This linkage between the peptidoglycan chain. The penicillin binding or peptidoglycan chains are cross-linkage as the final step in this picture. In the synthesis of peptidoglycan, this process is blocked by penicillin. So penicillins inhibit this transpeptidase catalyzed reaction, thus hindering the formation of a cross-link essential for cell wall integrity. This is the second mechanism of penicillin, as to interfere with the cell wall synthesis. The third and the last mechanism is the production of autolysins. Mechanism of action. Many bacteria, particularly gram-positive cocci, produce degradative enzyme, which is autolysins, that participate in the normal remodeling of bacterial cell wall. In the presence of penicillin, the degradative action of the autolysins proceed in the absence of cell wall synthesis. Thus, the antibacterial effect of a penicillin is the result of both inhibition of cell wall synthesis and destruction of the existing cell wall by autolysins. This is as the third mechanism of action. The summary of all these mechanisms of action of penicillin, as we said, penicillin binding protein, penicillin inactivating numerous protein on the bacterial cell wall membrane. These penicillins binding proteins are bacterial enzymes involved in the synthesis of the cell wall and in the maintenance of the morphologic features of the bacteria. Second mechanism of action, inhibition of transpeptidase. Penicillins inhibit this transpeptidase catalyzed reaction, thus hindering the formation of cross-links essential for cell wall integrity. As a result of this block of cell wall synthesis. Third mechanism, production of autolysins. Many bacteria, particularly the gram-positive cocci, produce degradative enzyme autolysins that participate in the normal remodeling of the bacterial cell wall. So this is the three important mechanism actions of the penicillin. Classifications of penicillin as a broad spectrum of the penicillins. We have narrow spectrum penicillins, or what we call natural penicillins, is beta-lactam sensitive, such as penicillin V, which is used orally, and which is acid resistant, and acid label penicillin G, enzyme penicillin given IM and IV, brocaine penicillin G, which is given IM and devoid injection, benzathine penicillin G, given IM and devoid injections. Beta-lactamase resistance, anti-staphylococcal staphylococcal penicillins such as gloxacillin, dicloxacillin, flocloxacillin, and acid labels such as methicillin, which is given IM, IV, and naficillin. Extended spectrum penicillin also such as amino penicillins, ampicillin, amoxicillin, bacampicillin, and talampicillin. Acid labels such as anti-pseudomonal penicillin and also different kinds such as carboxypenicillin and penicillins. Now, speaking about resistance. Natural resistance to penicillin occur in organisms that either lack a peptidoglycan cell wall, for example, such as mycoplasma pneumonia. Mycoplasma pneumonia lack a peptidoglycan cell wall, so it's or have cell walls that are impermeable to the drug. So resistance to penicillin could be happen if the organism lack a peptidoglycan cell wall يفتقد لهذه الخاصية أو it have or cell wall that يكون لا يسمح بنفاذ الدرج إلى داخل الخلية. هنا تحدث مقاومة resistance to this drug. Acquired resistance to penicillin by plasmid-mediated B-lactamases has become a significant clinical problem. أصبحت مشكلة صحية واضحة اللي هي acquired resistance to the penicillin by plasmid-mediated beta-lactamases. Beta-lactamases enzyme hydrolyzes the cyclic amide bond of the beta-lactam ring, which result in loss of bactericidal activity. راح يسبب فقدانها القابلية لقتل البكتيريا. So beta-lactamase enzyme hydrolyze the cyclic amide bond of the beta-lactam ring. يأثر على البيتا-lactam ring. يسوي لها hydrolyze. So ينتج عنا loss of bactericidal activity. Other mechanisms involve decreased penetration of antibiotic through the outer cell membrane of the bacteria, prevent the drug from reaching the target penicillin binding protein. In addition, modified penicillin binding proteins have a lower affinity for beta-lactam antibiotic, requiring clinically attainable concentration of the drug to affect inhibition of bacterial growth. This explains MRSA resistance to most commercially available beta-lactams. And we know that MRSA, it is methicillin-resistant Staphylococcus aureus. It is a cause of staph infection that is difficult to treat because of resistance to some antibiotic. Pharmacokinetics of penicillin. The route of administration of beta-lactam antibiotic is determined by the stability of the drug to gastric acid and by the severity of the infection. The combination of ampicillin with sulbactam or ticarcillin with gravulonic acid and pipiracillin with tazobactam and the anti-staphylococcal penicillins must be administered IV or IM. Penicillin V and dicloxacillin are available only as oral preparation. Others are affected by the oral IV or IM. IV administration of penicillin G is preferred to the IM route because of irritation and local pain from intramuscular injection. Devoid forms such as brocaine penicillin G and bizafine penicillin G are administered IM and serve as devoid form. They are slowly absorbed into the circulation and persist at low level over a long time period. For absorption, most of the penicillins are incompletely absorbed after oral administration. They reach the intestine in sufficient amount to affect the composition of the intestinal flora. Food decreases the absorption of all the penicillinase resistant penicillin because as gastric emptying time increase, the drugs are destroyed by stomach acid, such amoxicillin being an exception. So food decreases the absorption of all penicillinase-resistant penicillin. Therefore, they should be taken on an empty stomach. Benzathine and brocaine penicillin are formulated to delay absorption, resulting in prolonged blood and tissue concentrations. Distribution. The beta-lactam antibiotic distribute well through the body. All the penicillins cross the placenta barrier, but none have been shown to have teratogenic effect. So they can cross the placental area, but they don't have any teratogenic effect. Penetration into bone or cerebrospinal fluid is insufficient for therapy unless these sites are inflamed. Penicillin's level in the prostate are insufficient to be effective against infection. Excretion. The primary route of excretion is through the organic acid tubular secretory system of the kidney, as well as by glomerular filtration. Patients with impaired renal function must have dosage regimes adjusted because the excretion through the kidney. Nafcillin and oxacillin are exceptions to the rule. They are primarily metabolized in the liver and do not require dose adjustment for renal insufficiency. Propanseed inhibit the secretion of penicillin by competing for active tubular secretion via the organic acid transporter and thus can increase blood levels. Clearance values are considerably lower than in neonate and infant because of incomplete development of renal function. The penicillins are also excreted by breast milk. The therapeutic uses of penicillin in case of abscess, beta hemolytic streptococcus, meningitis, otitis media, pneumonia, respiratory infection, tooth and gum infection, venereal disease such as syphilis and gonorrhea, and endocarditis due to streptococci. This is regarding to the therapeutic use of penicillin. Adverse effects. Penicillins are generally well tolerated, and unfortunately, this may encourage inappropriate use. Hypersensitivity reaction, one of the common adverse effects of penicillin. The antigenic determinants are degradation product of penicillin, particularly penicillic acid and products of alkaline hydrolysis bound to host protein. Approximately 5% of patients have some kind of reaction, ranging from rashes to angioedema, which is marked swelling of the lips, tongue, and peripheral area, and anaphylaxis. Cross-allergic reactions occur among beta-lactam antibiotic. A history of penicillin reaction is not reliable. Many people claim such a history, but only a small number of these will have a serious reaction when given penicillin. Penicillin skin testing may also be used to evaluate type 1 hypersensitivity. If skin testing is negative, most patients can safely receive penicillin. and that's why it's important. It is important to do penicillin skin test before, especially penicillin injection. Okay. Thank you for listening. This is our lectures for today, and I'm ready to answer any question you have. You can send me in Google Classroom. Good luck.